Outsmarting booby traps, prenatal breastfeeding education. My name is Laura Dearman. I'm an international board-certified lactation consultant, owner of Health and Lactation, and the mother of 5 breastfed children. How to outsmart booby trap number 1, prenatal breastfeeding education. Research shows that prenatal breastfeeding education significantly improves the rate of breastfeeding at 6 months postpartum. The purpose of this presentation is to introduce you to the basics of early breastfeeding in order to help you meet your breastfeeding goals with grace and confidence. How to outsmart booby trap number 2. Know your milk production risk factors. Breast changes during pregnancy are a positive sign your body is gearing up for lactation by creating more ductal tissue. Normal breast changes are positive indicators of a healthy milk supply. You might be experiencing darker or larger nipples, darker or larger areolas, breast tenderness, visible veins, breast size increase. If you are unsure about your breast changes that have occurred during pregnancy, ask your partner. They are often keen observers of subtle breast changes. Did you know that breast size doesn't indicate milk-making abilities? Breast size is determined by adipose fat, but glandular tissue is what makes milk during lactation. Medical conditions can affect maternal milk supply. The following medical conditions may negatively impact milk supply and may disrupt the normal course of lactation. Thyroid disease, PCOS, gestational diabetes, type 2 diabetes, insulin resistance, metabolic disorders, high blood pressure, preeclampsia, retained placenta, postpartum hemorrhage. Tubular and or widely spaced breast can be a risk factor for insufficient glandular tissue. Information is power, so we will discuss your personal risk factors and relevant medical history during your individual prenatal visit to support your goal of breastfeeding your baby. Research is very clear that birth practices can affect breastfeeding. Inductions and cesareans are risk factors for delayed lactogenesis 2, which is the transition from colostrum to mature milk. A slower transition to mature milk increases the risk of needing to provide supplemental feeds to your baby in early postpartum. Based on my clinical experience of a lactation consultant, babies who are born at 40 plus weeks are typically born ready to breastfeed with enthusiasm and vigor. I see many more latching challenges with babies born at 37 to 39 weeks. Avoiding unnecessary inductions and waiting for spontaneous labor is a protective factor for a successful early breastfeeding relationship. I understand some early deliveries are medically necessary, but I urge you to advocate for staying pregnant as long as possible. But your baby's birth does not dictate the future path of your breastfeeding relationship. If you have not already, consider hiring a doula for your baby's birth. All families and all births, from your planned cesareans to your home births, benefit from the presence of a trained doula. There are many success stories of babies breastfeeding of all gestational ages. How to outsmart booby trap number 3. Benefits of prenatal expression. Prenatal expression. Research shows early hand expression increases maternal confidence, which often leads to better breastfeeding outcomes. Many parents choose to pump in addition to prenatal hand expression. If you do choose to pump while pregnant, be sure to use very low pump settings and stop pumping if your nipples or breast feel painful or sensitive. Talk to your maternity care provider before beginning prenatal expression, but I generally recommend practicing hand expression beginning around 37 weeks of pregnancy. Colostrum is best stored in very small capped syringes, easily purchased from Amazon. Simply pop the syringes with your expressed colostrum in a Ziploc bag into your freezer for early postpartum supplementation if needed. Colostrum is the first milk your body makes for your baby. Colostrum production, also known as lactogenesis 1, begins around 16 weeks gestation. Whether or not your breast leak colostrum during pregnancy is not an indicator of future breastfeeding success. Colostrum is yellow due to high levels of vitamin A. Colostrum is thick and produced in very small quantities to make it easier for your newborn to learn how to coordinate their suck, swallow, breathe reflexes. Colostrum is full of immunoglobulins, minerals, protein, and other vital nutrients necessary for a newborn to thrive. These are my 2 favorite hand expression videos. Please note these videos feature moms whose babies are already born and their milk is flowing, but the process is the same for prenatal hand expression, just with less milk flow. Celebrate every drop. How to outsmart booby trap number 4. Skin to skin is magic. The golden hour is the first hour after birth, where mothers hold their freshly born babies skin to skin on their chest. There's a body of research suggesting that this practice is beneficial to both birthing parent and babies. Skin to skin stabilizes baby's temperature, their heart rate, their respiration, and their blood sugar levels, as well as promoting bonding. If your birthing circumstances do not allow for a golden hour immediately after your baby's birth, do not worry. The golden hour may refer to immediately after birth, but the benefits of skin to skin never expire. How to outsmart booby trap number 5. Newborns are born to breastfeed. Babies are born with primitive reflexes that help babies breastfeed. Babies are born with the innate ability to find the breast, latch, and suck. Watch these videos to see newborns use their reflexes to feed without the help of their mothers. How to outsmart booby trap number 6. The power of responsive parenting. Early postpartum is an intense time. Intense hormones, intense physical sensations, and an intensely needy baby. Pregnancy accustomed your baby to 24-hour effortless nutrition, nonstop warm cuddles, and lots of gentle movement. Your baby has no idea that expectations are different now that they are born. Be prepared for your baby to nurse very frequently during early postpartum. Babies should feed at least 8 to 12 times a day. Breast milk is highly bioavailable and easily digested, making frequent feeds a nutritional necessity. Frequent feeds also support healthy milk supplies, which depend on supply and demand beginning around day 10 of your baby's life. Many new parents try to equate this to nursing their baby every 2 to 3 hours, but in reality, babies will cluster feed with longer, more robust feeds, intermingled with clusters of shorter feeds when they are fed on cue during the early weeks. When in doubt, boob the baby. Cue-based feeds. Early cues are the ideal time to offer the breast. When you start feeds with early cues, you have a few minutes to get the latch just right with a more evenly tempered baby, rather than waiting for later cues when your baby is screaming, "Feed me now." Ideally, the green zone early cues would say, "I can eat," rather than "I'm hungry." Would you rather arrive to your favorite restaurant, the Booby Bar, with big feelings about your starting belly? Or would you rather arrive feeling relaxed and low-key excited about the meal to come? Early cues look like very subtle movements, small wiggles, eye flutters, mouth openings like a baby bird, primitive reflex expressions like rooting and seeking the breast. Orange zone mid cues are more active, as your baby has quickly transitioned from I can eat to I'm really hungry. You will notice stretching, vigorous wiggles, and the sign that many families confuse as the first cue for feeding time, hand to mouth with vigorous sucking. Hand to mouth quickly moves into the red zone, calm me, then feed me territory. These cues are an upset baby who probably can't latch at this point because they are crying and deep in their feels. What's the trick for catching your newborn's earliest feeding cues to facilitate less stressful breastfeeding? It's not a trick. It's responsive parenting. Keep your baby close so you don't miss their early feeding cues. Avoid swaddles. Yes, most newborns love a tight swaddle, but swaddles also depress primitive reflexes and essentially force babies to sleep through early hunger cues, which becomes a pattern of newborns waking up hungry and demanding to be fed now, which is a quick recipe for stressful feeds. Keep your baby in your arms. Human babies are categorized as carry mammals, like apes, kangaroos, possums, koalas, pandas, and other mammals that require their mothers to carry them for an extensive period due to their immaturity at birth. Your baby needs to be in your arms to promote physiological development. Baby wearing, all of the snuggly benefits of swaddling with all of the beautiful benefits of being carried. Hands-free carrying for the win. Skin to skin. The mother's body is the baby's habitat. Skin to skin benefits extend far beyond the golden hour. Avoid baby containers. Devices that vibrate, swing, or rock are simply poor substitutes for human contact and natural movement. I promote floor time on a soft mat or blanket as a superior way to keep babies safe when arms are not available during daytime hours. Babies breastfeed with their entire body and require lots of opportunities to move for neurological development. Your baby was born to move. How to outsmart booby trap number 7, achieving a comfortable latch. A deep latch is a comfortable latch. Remember, we call it breastfeeding, not nipple feeding. To feed well, your baby needs a large mouthful of breast tissue to fill their oral cavity. Just holding onto the nipple with their mouth will not feel good to you, nor does it allow the oral function necessary for milk to flow. Here are the secrets for a deep latch. Lean back and get comfy like you're watching a movie or reading a book. Hold your baby so their belly is making full contact with your belly. Line up your nipple with your baby's nose. This can be counterintuitive and may require you to shift your baby down more than you anticipated. Your baby's head needs to be tipped back for a deep latch, so don't hold the back of their head, which can limit neck mobility. Your baby's gape reflex, which tells the mouth to open wide, lives in the chin. Hold your baby close so their chin makes contact with your breast. Your baby will always choose to breathe rather than drink milk. If it feels like your baby is fighting the breast, check their neck to see if their airway is open. You should be able to put one, preferably 2 fingers in their neck. Velcro baby means your body provides postural support for your baby, not a pillow. Pillows are for arms, not for babies. Remember how babies breastfeed with their entire body? You are seeking full body contact for a deep latch. This is a great video about different breastfeeding positions that promote deep and comfortable latches. What if it hurts to latch? Unlatch and try again. Hand express and feed if your baby is upset and hungry. Then try to latch again with early cues. Are you leaning back with relaxed shoulders? Check position basics: belly to belly, nose to nipple, chin to breast. Request a nipple shield, and then book a visit with me. Remove the breastfeeding pillow and use your body to support your baby. Remember, pillows are for arms, your body is for your baby. If your nipples are damaged, hand express and pump to feed your baby and protect your supply. Book a visit with me ASAP after discharge. But what if your baby isn't latching at all? Here are the action steps to take. Remember, your baby was born with a belly full of amniotic fluid. It's okay if your baby takes several hours for their first latch and feed. Skin to skin on your breast. Your body is your baby's habitat, and your breasts are his home. Begin hand expression within 1 hour of birth. Ask your nurse or midwife for help if you need it. Feed your baby with thawed or fresh colostrum. Avoiding bottles is best in the early days. Best practice is to supplement newborns with a spoon, syringe, or cup. More on that soon. Begin pumping around hour 6 after birth. In addition to hand expression, it is vital to protect your milk supply. Pump every 3 hours with 1 4-hour stretch of sleep at night. How to outsmart booby trap number 7, overcoming early challenges. Early postpartum supplementation. The best practice is to supplement your baby with your milk, not formula, if your baby is not latching. Newborns only need a very small amount of colostrum to satisfy their hunger and nutritional needs. Use frozen prenatal colostrum or freshly hand-expressed postpartum colostrum to supplement if needed. Syringes, cups, or spoons are perfect for colostrum supplementation because they are low volume, which manages expectations of how much a newborn should eat in one sitting. Early postpartum supplementation with bottles is a major risk factor for future latching and breastfeeding difficulties. Try to avoid bottles for the first several days of life. Bottle feeding is a huge reason to book a visit with me very soon after delivery. Optimizing bottle feeding is a very important step to moving toward successful breastfeeding for babies who are not successfully latching. Here are videos for early postpartum supplementation showing newborns being fed with a syringe, a cup, and a spoon. Milk maturation. Most people notice their milk coming in between days 3 to 5 of their baby's life, but there are many risk factors that can delay mature milk production, like cesareans, inductions, gestational diabetes, or obesity, just to name a few. Mature milk has a very high water content, and when expressed, it looks like cow milk. Because of this drastic increase in the volume of water in your breast milk, engorgement is common with the transition to making mature milk. You will know if your breasts are engorged because they will feel full, tight, maybe lumpy or rocky, or even hard with your nipples stretched out tight. As soon as you feel any of these uncomfortable sensations, your first step is to do gentle massage. Many parents struggle with how gentle is gentle enough. My suggestion is to think of your breast as an extension of your baby. Gentle breast massage should be the same amount of pressure as stroking your baby's cheek. Very, very gentle. How to outsmart booby trap number 8. Know if your baby is getting enough milk. Monitoring your baby's bowel movements is an important way to monitor your baby's milk intake. Day 1 of life, 1 poop. Day 2 of life, at least 2 poops. Day 3 of life, at least 3. Day 4 of life and beyond, your baby should have at least 4 poops. Milk in equals poop out. Breastfed babies should always poop several times a day. Breast milk has laxative properties, and many components of milk are not digestible. So it is a myth that breastfed babies don't need to poop every day. The very first intervention for a baby that isn't pooping appropriately is to provide more milk. Remember, milk in equals poop out. All about that poop. Your baby's first poops are meconium, thick, sticky, tarry, and very dark. The more milk your baby drinks, the quicker you will see transitional milk. This graphic shows transitional milk as green, but sometimes this graphic shows transitional poop as green, but sometimes it's more brown than green, and that's okay too. Once your milk has transitioned to mature milk, a baby who's being fed at least 8 to 12 times a day will have the most exciting infant poop of all, bright mustard yellow. Some poops will be big and some poops will be small. But remember, lots of poop is a great sign that your baby is drinking plenty of milk. Mature milk poop can be liquidy, seedy with milk curds, or a combo of both. If you are worried about your baby's poop, take pictures and plan a visit with me to make a plan for moving forward. How do I know if my baby is getting enough milk? Is your baby pooping appropriately? Is your baby relaxed or milk drunk after feeds? Does your baby have soft, open hands after feeds? Do your breasts feel softer after feeding? Is your baby maintaining their growth curve on their chart? If the answer is no to any of these questions, it is time to express your milk to protect your supply and to feed your baby. Remember, try to avoid bottles during early postpartum and book a visit with me ASAP after discharge. To pacifier or not to pacifier? Ideally, sucking needs are met at the breast, but some babies are more high needs than others. Pacifiers aren't bad, they're just a tool in the toolbox. If you choose to offer a pacifier, focus on limiting time with the pacifier in order not to accidentally limit opportunities at the breast. There is no such thing as a newborn spending too much time at the breast, as long as it doesn't hurt, of course. You are not a pacifier. You are breastfeeding, and please feel free to let anyone know that says you are just a human pacifier. How to outsmart booby trap number 9, nighttime parenting. Newborns are intense. Newborns should be fed every 2 to 3 hours at night. You need to wake your baby up until they reach and exceed their birth weight. More sleep for your newborn is not the priority, but 4-hour stretches of sleep are restorative for recovery from birth. Some new parents need just a few 4-hour stretches, and some parents need a 4-hour stretch of sleep every night to protect their mental health. SIDS prevention and safer sleep. These are the SIDS prevention basics. Back to sleep, breastfeeding, safe sleep environment. Babies should sleep in the same room as their parents for at least the first 6 months of life, preferably the first 12 months of life. Avoid overheating using light layers. Frequent night wakenings are not only normal, but protective against SIDS. Your baby needs to eat frequently because breast milk is quickly digested, but because frequent wakenings are also highly protective against SIDS. The goal should never be for an infant to sleep longer stretches at night. No swaddles that discourage the Moro reflex or their startle reflex. When babies startle, they throw their heads back and take a deep inhalation. Yes, this might wake your baby up more than you prefer, but they are protecting themselves from the dangers of deep sleep. Celebrate your baby for keeping safe rather than depressing this wonderful reflex. What about bed sharing? All families need information for safer bed sharing because even though bed sharing is underreported in the United States, typically due to fear of judgment, research is very clear that almost all families will bed share at some point in their infant's first year of life. The Safe Sleep 7 is La Leche League's research-based guidelines for safe bed sharing. I'll go through these guidelines. Number 1, no smoking. Prenatal and postpartum cigarette smoke exposure is a major risk factor for SIDS. Since we don't have research guidelines to inform us on the SIDS risks of vaping and cannabis smoke, my suggestion is to consider all forms of smoking as a major risk factor. Number 2, sober adults. No alcohol and no medications that might make you drowsy, including pain medications after cesarean sections. Number 3, breastfeeding. Not all safe bed sharing guidelines include breastfeeding, but research is clear that breastfeeding is protective against SIDS. Number 4, a healthy baby. Research shows premature babies are at higher risk for SIDS, although those risks do decrease as the premature infant grows. Number 5, baby on back. While there are many confounding factors at play regarding back to sleep research, SIDS deaths reduced by 87% with the Back to Sleep campaign. Bed sharing infants will turn on their side to breastfeed and ideally should be placed on their back after nursing back to sleep. Number 6, no sweat, light clothes, and of course, no swaddle. Number 7, safe surface, firm mattress, no extra pillows, no toys, no blankets or covers, no strings or cords, and gaps are firmly filled with tightly rolled blankets. Now is my hard truth time about infant sleep and nighttime parenting. Books and programs like Taking Care of Babies, Moms on Call, or Baby Wise, or any book or program that teaches parents wake windows, putting babies to bed awake but drowsy, eat, play, sleep, sleep training, controlled crying, or schedules are not breastfeeding or baby friendly. How to outsmart booby trap number 9, postpartum mental health matters. Baby blues are normal temporary mood shifts with irritability, tearfulness, and anxiety. Baby blues should resolve within a few weeks. But some parents are at higher risk for postpartum mental health disorders. They might have a family history of depression or bipolar, a personal history of mood disorders, previous diagnosis of postpartum mood disorders. They might live in environments of high stress, domestic violence, or be experiencing financial problems. Addressing postpartum mental health issues can significantly improve outcomes for both the mother and the baby. These are the red flags for postpartum mood disorders: intense irritability, anger, rage, difficulty bonding with the baby, withdrawing from family and friends, changes in sleep or appetite, loss of interest in activities that were once enjoyable, feelings of hopelessness, worthlessness, or guilt, restlessness, anxiety, or panic attacks, intrusive thoughts of harming the baby or oneself, rapidly changing moods, delusions, hallucinations, severe agitation, confusion, or mania. If you have concerns now about your mental health for after your baby is born, or if you find yourself struggling postpartum, reach out to someone you trust and ask for help. This is a wonderful video by Emily Phelps, and it explains her mental health journey, more than just depression, a postpartum mental health journey. I have linked Postpartum Support International. It's an excellent resource with local provider referrals, free online support groups, helplines, and information for the whole family to support postpartum mental health. You don't have to suffer alone. You just have to reach out. How can your partner help during early postpartum? They can provide emotional support, encouragement, patience, understanding. Take pictures of you with your baby. Practical support, bring water, prepare snacks and meals, diaper changes, the all important dishes and laundry. They can help with sleep and rest. They can help facilitate 4-hour stretches of sleep for the birthing parent if needed. They can wake up at night and help you with non-nursing tasks. They can bond with their baby, lots of skin to skin. They can learn about breastfeeding and normal infant behaviors. How to outsmart booby trap number 10. Lactation is preventative care. Book a visit with Laura on your to-do list for after your baby is born. I will always find a way to fit my prenatal clients with new babies into my schedule. You can visit my website or text me at 850-345-2760 to make sure you get on my schedule ASAP. Lactation care is preventative care. It is always the right time to book a visit with your IBCLC because you and your baby are constantly evolving through your feeding experience. But you need to see an IBCLC if you need a pumping flange fit. That means if you are pumping, if baby isn't latching, if baby has a painful latch, whether you have nipple damage or not, if you are exclusively pumping and bottle feeding, if feeds are stressful, if you are using a nipple shield, if your baby is upset and unsettled, if your breasts are engorged, if you have plugged ducts, mastitis, or generalized breast pain and inflammation, if you are supplementing with donor milk or formula. Your prenatal visit will be all about you to prepare you for early postpartum breastfeeding. We will discuss why you want to breastfeed, how you feel about your breast and your ability to make milk, your personal feeding goals, your previous infant feeding experience, if applicable, your personal health history that might affect lactation, breast changes you have observed during postpartum, and of course, early postpartum breastfeeding. Thank you for watching and taking the time to learn about early breastfeeding best practices. I'm looking forward to your prenatal visit. See you soon. Thanks.